Now, third wave has already hit our country as India witnesses a massive surge in COVID-19 cases. Omicron variant is seen to go on an upward trend. As the country fights Omicron tsunami, doctors advise some home must-haves. Vitamins, paracetamol, oximeters, thermometers are the must-haves in every single household with every single individual. There are certain tablets that can be taken as precautionary proactive measures. That's molnupiravir that should be taken only on doctor's prescription. And let's take a look at the Omicron precautionary measures that need to be taken to battle the COVID wave successfully. And actually, before starting off this bulletin, I would like to remind my viewers, we have been saying this again and again for a larger part of the last 2 years that have gone by under the wake of this dreaded virus. It was first the COVID-19, there were Delta, Alpha, and finally we have the Omicron variant. The important part at this time for my viewers to understand is that we need to wear masks. And while we were wearing these surgical masks when the cases were waning before November 2021, it is no more of usage to actually go ahead and wear these single ply or double ply or even 3-ply masks. You cannot wear your gamchas or your shawls or your dupattas or your cloth masks or those decorative embroidered or sequin masks because they are not really going to help. Aesthetically, they might look pleasing, but really do not solve any purpose. What is important at this time is to actually wear the N95 masks. Now, this is exactly what it looks like. You cannot wear your N95 mask putting it down on your nose. You can't have it adjusted completely down under your chin. It has to be securely fitted on your mouth and on your nose. And this is exactly the way to wear the N95 mask. I decided to tell my audience about this because even now, while going out on the streets, wanting to reach my office, media being an essential service, and you cannot really stop yourself from stepping out of the house, you actually witness scores and scores of people still not wearing the mask properly. Now, that is the single way you can stop the resurgence of the virus in Delhi, in your respective part of the state or region or district that you live in. That's exactly what the Chief Minister of New Delhi has gone ahead and said, that there is going to be no need for putting in red alert and a total lockdown into the state if people decided to mask up, if people decided to stay back in their homes, and if people decided to maintain social distancing as and when it was necessary for them to step out of their houses. Let's open up this discussion. Padma Shri, Professor Dr. Mohsin Wali on the broadcast with me. Professor Mohsin Wali, while these cases are surging, what are these precautionary measures, these preventive actions, proactive actions that can be undertaken by the people to ensure that they are lesser prone to the virus? I know I have it in my home. I have the vitamin C tablets, which I've been taking every day now. I have the zinc tablets that I've been taking place. I have my thermometer and I have my oximeter, and so is my entire staff at this point of time equipped with it to ensure that in case there is any calamity, there is a positive case that has taken place in my house, I can be of use by providing these emergency services. What are the advantages of actually taking these precautionary preventive measures?
Yes, Megha, you very thoughtfully has joined up all the positive things together to make a big preventive line, big line of defense. And this is the need of the hour. And as you rightly said, people are still callous, they are lackadaisical, and they are trying to find excuse for wearing mask. Ideally, we should wear double mask at this juncture. Lots of doctors are also getting involved, affected, and today if we roughly see the count in the country, about 2,000 doctors, even more are they are bitten by the Omicron or coronavirus. And Delta has not gone yet, which is also quite powerful virus. So, Megha, mask is the defense, and we have to keep our defense strong. And everybody wants to keep the gate of the house closed. So why we are keeping our gate of the body open? The gates of the body is mask covers them, mouth and mainly nose, because we are breathing through the nose. Virus is in the air and we have to protect. You rightly said nothing short of a well-fitting N95 mask. Well-fitting means it should be snugly fit, tight, and it should not be throwing our vapors of the mouth or breath to the glasses, and glasses should not get foggy. And if we can wear a plain glass, if we are not used to glasses, then also it is eye protection as well. There are things which have been repeatedly said through you, through other channels, through media, and a lot of education of the patient is done, but somewhere it is lacking. So the distance is also being talked about, and I would briefly mention about the pets also. So when we come to distance, ideally more than, I would add adjective, more than 2 meters, because this virus can travel faster, it can travel in more density, because those people who are suffering, if they are asymptomatic, we may not get an idea that they are throwing virus in the air. And if that person is not wearing mask, the danger is more than 50% of catching infection if one person is wearing mask. I'm just very simply saying this. There are data to support if both persons are wearing mask and how much is the infection. If they are maintaining adequate distance, we can reduce it by 90%. So even then there is a chance. So be careful. One has to be careful. Avoid touching eyes, nose and mouth repeatedly. Avoid close contact, as I said. And this period is roughly 10 days. If one has infection, he should not think after 5 days symptomatically he may feel better, but he may still be excreting the virus in the air. You can't measure. We can't measure. You see, that is the irony. That is the tragedy. And we should frequently disinfect the objects which we are touching again and again. Household objects, crockery and things in the drawing room, and sanitize your hands repeatedly. Wash hands. We are forgetting that we have to wash for 20 seconds or more. And stay informed. Care of pets is also equally important. Don't let your pets go out. Don't take the pets out. And the best is stay at home if you can. So safety is a big word. Isolation is a big word. Wearing mask is a big word. And correct mask, as you very rightly said, as you very rightly shown, it is the need of the hour. It's next 2 weeks we have to be very careful, because the virus is and numbers of cases are increasing. They are multiplying rather, they are not increasing. And we are getting newer cases. And when the tests are not done in each case, we cannot get the correct data. So, and at the same time, Delta is by the side. So all this kept together, the only thing which can prevent us is mask and the booster dose. And those who have not completed the second dose, they should come out quickly. Second dose, I would not talk about those people who are careless, who have not even taken a single dose. So please be kind to the society. Be careful for your own family and yourself, and take the vaccination. And now nobody can say vaccines are not available. You can just go out, and our healthcare workers, they should also be very particular of their health, and
Absolutely.
They should do all those measures which we talk about to the patients. And this is a very high time that our health workers should not fall prey to this virus, and we should be available for the patients as we are required in great quantity, great numbers, to attend to these sick patients and rest.
Unfortunately, there has also been news pouring in of a number of doctors, frontline workers, healthcare workers falling sick in hordes, and they have been told to isolate and get themselves in quarantines, causing a massive shortage when it comes to the healthcare infrastructure to help the ones who are suffering at this point of time. Remember, at this point, there are 90% of the oxygen beds across the states in our country that are empty. So, which is good news, but nothing to be feeling complacent about. But because these numbers could only increase, and increase very, very rapidly. Like you already mentioned, Dr. Wali, that the next 2 weeks are going to be important. Delhi is going to reach its peak perhaps in the next couple of days, maybe even today. It's just a chance that you're taking. If you step out, that you might get the virus. There is more chance of you getting the virus than not. And that's why keeping yourself and your family members and loved ones secure is something that needs to be priority. Therefore, sitting at home needs to be your priority. Dr. Bagai, if you could explain to us what are the preventive measures, precautionary, proactive measures that can be taken. Those who have still not tested positive, they are healthy, but they would like to have their immune system boosted. Do zinc tablets and gargling your mouth and keeping other hygiene help in avoiding the virus getting transmitted into your body?
Hi, good evening. So putting science on the table, zinc, there have been large amount of studies because zinc has been used and overused and abused in the first wave and second wave. There has been some amount of correlation between low zinc levels and COVID, mild to moderate, but it has shown no effect on all-cause mortality. So therefore, zinc has no role in the management of COVID. Vitamin C is an over-the-counter drug. It has no role to prevent the onset of COVID, prevent infection, or to decrease the all-cause mortality. There are a lot of other home remedies which are including Ayurvedic and homeopathic and herbal medicines and alternative medicines. They have no role in any part of COVID management. So does Remdesivir, does not figure in the WHO and CDC list of recommended drug therapies, neither does Fabiflu. No unnecessary use of antibiotics, including azithral, it has no role. No unnecessary other over-the-counter antibiotics, unfortunately, which are readily available in India. A lot of people have been started taking Augmentin for some reason in the last week, 10 days, thinking they will prevent a cold and cough and sore throat. It has no role. There is no need of any decongestant therapy. There is no need of unnecessary cough syrups. And let me add, a lot of cough syrups have some amount of sugar base. So especially the elderlies and diabetics need to be extra careful with it.
Okay.
A plain simple paracetamol that is also on strictly SOS basis is the only treatment you need to take. You may do a little bit of saline gargles. Steaming has no role, especially in children. It definitely doesn't have a role because it makes the respiratory mucosa more wet. So your respiratory mucosa drips more with moisture. It has no role. All you need is paracetamol on SOS basis. You need a good sensitive pulse oximeter to check your saturation every 6 to 8 hours. People who are on antihypertensive medicines and other routine medicines must continue the medicines. Do monitor your blood sugar and your BP recording at least 2 to 3 times a day. You can WhatsApp or e-consult your local doctor to inform them the values. A well-fitting N95 mask is important. Surgical mask, cloth mask, single-head mask are no use at all. And please wear your mask in layers. If you're wearing a double-head mask, the surgical mask should be the in base and your N95 mask should be the out base. With regards to the specific don'ts, please do not use NSAIDs. Do not use medicines which contain brufen, nimesulide, aspirin because they can harm your platelet count and indeed cause gastritis and vomiting. Do not take antivirals prophylactically or indeed after testing positive. Please consult your doctor. The molnupiravir, which is available through Merck, is for early and for mild to moderate, but that too under restricted use. Please consult your doctor. Do not use it on your own. Do not touch steroids. I'm again repeating, steroids have no role in the management of Omicron. This is more an upper respiratory illness. It can acutely shoot up conditions like glaucoma, hypertension, arrhythmias, electrolyte imbalance, and indeed precipitate for fungal infection. Timing of your test is extremely important. Don't rush in on day one to get your RT-PCR. Your RT-PCR will come more positive towards the second day. You must encourage, we all should in fact encourage home testing. It's a good sensitive manner. Lateral flow rapid antigen test has a good sensitivity and specificity. Do not hide your report. Please inform your local healthcare authorities and your doctor. Your trick really is, as a summary point, stay home as much as possible. A double mask, and if you wear mask in layers, it has shown to decrease your viral count in your mask sixfold. Double mask, avoid crowds, poorly ventilated places, hydrate yourself well, eat well, and get yourself vaccinated. Vaccines will prevent 9-fold infections and 25-fold risk of death. Masks will prevent the infections. Vaccines will give you long-term immunity.
Absolutely. Dr. B.S. Vivek, in case an individual does end up contracting the Omicron variant, there have been a lot of shifts that have been made by the health agencies, administrations across the globe and in India as well, in terms of what should be the protocols that need to be followed, what kind of treatment needs to be given, what is the home isolation period, when is it that hospitalizations need to be the priority, when is it that you just need to sit at home and get yourself self-medicated. How do we go about through these plethora of things that are out there, but confusion reigns supreme?
Yeah, Megha, you're right. There is a lot of confusion because the authorities have yet to come up with real the guidelines that were there the last time. But we are having inputs now. There is this Ministry of Health and Family Welfare guideline as far as asymptomatic and mild infection is concerned. They have come up with a definite period now that if you have been infected and you remain either asymptomatic or mildly symptomatic, there are definitions for that. And then in that case, you need not be hospitalized. And then there is this basic duration that they have also confirmed, that if you have been infected and you have passed a 7-day period and you have been fever-free for the last 3 days, then you are fit to go. There is no need for a repeat test also in that case. Unfortunately for our mankind, for our population, for our society, this virus, this variant of this virus is definitely mild in nature as far as hospitalizations and death rates are concerned. The infectivity is huge. It's much more than the Delta or the Alpha variants, but then that may be a blessing in disguise, because the more people mildly infected, the more the chances of herd immunity. Is like a nature's vaccine that we are all talking about. Now, as far as drugs and severity of the infection is concerned, I happen to just have finished my quarantine today, and seeing it both from the doctors and the patient's point of view, as a person who has undergone this 7-day quarantine, I did have a mild sort of an infection. And in that, all you have to do is keep yourself well monitored, well hydrated. Nutrition should be sufficient, and you should keep yourself mentally upright also. I mean, there is huge talk of not being influenced by negative news and negative frame of mind. It does affect our immunity. And pulse, blood pressure, oxygen saturation, vitals that we call them, the pulse, the respiratory rate, oxygen saturation, the blood pressure, and in case of diabetics, the blood sugar. Now, these are the basic things. We can, we can make a chart of it, and it's thrice a day that we can monitor these vitals thing, not the sugar part, they are the others. And along with that, there are guidelines. See, for example, saturation falls less than 93% now. There has been a slight modification. If the saturation falls anytime less than 93, the respiratory rate goes more than 24 per minute, or the pulse remains more than 100, or the patient remains febrile, more than 100 degrees Fahrenheit for 3 days in consecutive days. These are the indications where you need to seek proper medical help and may even require hospitalization. Fortunately for the large population, this sort of a situation has not been reached this time on. And it's basically an upper respiratory tract involvement of this variant, which is a blessing for us. And the lower respiratory, the pneumonia part, the thrombogenicity, and all those things which led to a huge mortality in the last wave. Luckily, we have not yet seen that sort of a surge neither in the South African, the origin of the virus, nor in our country at the moment.
Okay.
But it's too premature to say anything. So let's keep our fingers crossed and keep ourselves protected.
Absolutely. Dr. Manoj Kumar, if you could join in the discussion and talk to us especially with regards to the first indications that were coming out. And as Dr. Vivek has also said, that he's just stepping out of the quarantine period, and we wish him speedy recovery and a healthy and hale atmosphere to come out of it. But there was a lot of confusion whether the virus is mild, whether it is severe. Is it as severe as Delta? It only attacks the upper respiratory tract of your body, and the lower respiratory tract is fortunately left alone, and therefore the severity is much, much lower. But in the last few days, there have been these comments and announcements by the World Health Organization and other health agencies across the globe that have modified their comments with regards to the severity of the variant. How should an individual at this point of time take a look at the way the variant is spreading? And even if it were a less severe form of the virus than was the Delta virus, if we have, its transmissibility is larger, huger. So the rate at which the hospitals could be filled in the next few weeks could be exponentially higher than what we witnessed during the Delta surge.
Yes, good evening. First thing I would like to say that whenever we talk about there is a mild disease with the Omicron, I think mild should be redefined. Because if you see the published data, that is a South African data, mortality is 2.7%, hospitalization is almost 50%. So WHO also warns that it should not be taken as mild, because you know that a lot of things are called long COVID syndrome. So effects of long COVID will come, and since the number will be very huge, and even a small percentage will need hospitalization, that will be a load for the healthcare infrastructure. And second important thing that it is not affecting, definitely, if you compare with the Delta variant, the lung pneumonia is very less. But at the same time, you should understand that it also there are so many things are of the immune injury. So it can produce immune injury just like the other variants. So we should be very cautious. And you rightly said that there is only two ways you can protect yourself. One is your mask, and another is your vaccine. So vaccines gives you some relief. With the severity of illness is less, death rate is less in the vaccinated population. And second important thing is mask. It is now totally clear. It is completely clear that for Omicron you require N95 mask. There is a British study, they used N99 mask, and they showed that in hospital environment there was zero transmission. So it is the high time that you should shift to this N95. N99 is not available right now in the country. So I think every time just thinking that it is a mild infection, I think this mild word should be redefined. And I think long COVID will be common with this disease also. So we should be careful before labeling it as a mild disease. Definitely, most of the patients are recovering well, 3 days fever and then some URI symptoms, upper respiratory symptoms. But still, I think that we should wait. It is too early to comment regarding the mildness of the disease.
Okay. I only have as much time. I thank my good doctors for sharing information, knowledge, and also the much needed awareness that needs to be created amongst people in our country who still continue to refuse to wear masks, still continue to be averse to the second dose and in certain instances even first dose of vaccine. Now these vaccine hesitant people need to be made more aware of, given more knowledge, and also understand the situation that the country and the entire world is going through. Be responsible citizens of the world, be responsible citizens of your respective region, for your family and for yourself, to allow for the spread of the virus to stop once and for all. I thank you once again for watching me on the broadcast. Stay tuned, because at 5 p.m. we take up the masking protocols. How exactly should the mask be worn? Which kind of mask needs to be worn? What are the ways the mask must not be worn? And why is it that people continue to refrain from masking? We'll take all that on the